Right. Dr. Napolitano, tell us a little bit about children. What should moms and parents, what should they do or what should they not do in order to make sure that the child has as good as a possible natural chance of seeing well and participating in life and not being handicapped by not realizing that he doesn't see things. I have heard people saying they got eyeglasses at the age of 16 the first time, and they said, oh my God, I didn't know trees have leaves, because it was just a ball to them. That's pretty sad, right? I mean, tell us a little bit about it. How common is things like that? Are there things parents should be watching out?
It's very sad, actually, and I see it on a regular basis, even in my office. Unfortunately, when you're a parent, you have a child, the child starts walking, you can see whether that child is walking properly, and you can correct it. You can teach your child, okay, this is how you need to walk. If they're talking, you could tell whether or not they have a speech problem because you can hear them. You cannot see what they see. Okay, and a lot of times the child has no idea that, like you said before, it has no idea that what they're seeing is not correct, that it's blurry, because they don't know how their mom and their dad sees. So the best thing you can do for your child is to bring them in and have an eye exam at least before they start first grade. Okay, if you look at the Optometric Association, the American Optometric Association, they will tell you that the first recommended eye exam for a child should be at 9 months of age, okay? But definitely before they start school, they should have an eye exam from an eye doctor, because a lot of times the screening that they get in school or the screening that they get at the pediatrician, it's just not enough. It just does not pick up things that we would during a comprehensive eye exam. Okay, I also do vision screening, and what I check at the vision screening is how the child sees a distance. Okay, but there's so much more to vision than just having that 20/20 number. A lot of times, and actually 7% of children that are diagnosed with ADHD, they actually end up having a vision problem that they just could not express, they could not verbalize, but right away these kids are put on medications because we right away assume they're not reading because they don't want to pay attention, they're lazy. Okay, in the meantime, this child cannot see, but they just don't know how to tell you. Maybe they see in double. Maybe the words are moving on the page. Maybe they keep losing place because their eye is just not tracking the word on the page. They just don't know how to tell you. The best thing you can do for your child, again, is to bring them in, definitely before they start school. Definitely by the age of 5, 6, the latest, they should have a comprehensive eye exam. And as a parent, if you do notice things before that, like for example an eye turn, the eye turns in or out, you want to bring them in. If you notice that the child gets too close to the TV, too close when coloring their coloring book, you want to bring them in. If the child rubs their eyes excessively, that could be a sign of blurry vision. You want to bring them in. So you want to pay attention to all these small things, but even if you don't notice anything, even if you ask your child, can you see clear? And they tell you yes, you still want to bring them in because there is so much more to the eyes, to vision, than just seeing that 20/20 line. So it's very important.
Well, you mentioned, this was quite amazing actually, because, what kept popping in my mind is, if you don't know the ideal scene, if you never ate a really good, fresh, juicy apple, you wouldn't know what an apple tastes. So whatever I give you, you go, oh, that's what an apple is, and you're fine with it. Do you understand? Or like you mentioned with the proliferation, which is gone when you get glaucoma, I think, right? And where,
right. Exactly.
So you don't know that you don't see it because you think this is normal. So a child seeing the letters on the blackboard, I don't know if school teachers still do blackboard stuff, but anyway, and it sees it a little fuzzy, and because of it becomes slow. Because I remember one time with my wife, in fact, I think it was probably the only time I was with my wife in a bank, but there I was, and I filled out some paper, and the girl hands me the little slip, and I look at it, and I couldn't fill it out. So I pushed it back to the girl and said, can you please fill it out for me? I tell you what it is. And, on the way out, my wife said, what's the matter with you? I mean, you acted a little stupid. I say, honey, I couldn't see that thing. Well, she says, why don't you say something? I go, say something? I was more shocked than anything else. I didn't know what was going on. Now, anyway, I even had, and that is when you have a point to go by. I could realize that at one point I saw it and all of a sudden I didn't. But a child who never really sees doesn't know something is wrong. I think what you just said is very important, and you doctors will see it, that something is going on here and then can fix it.
I mean, I have patients sometimes they come in. My first question is, how's your vision? And they say, my vision is great, my vision is good. Then I'll put their chart on and they can only read the big letter. That's not great vision. That's very poor vision. They do not know the difference. They do not know how they are supposed to see.
Right. Just like a colorblind person will never know he's colorblind if somebody doesn't tell him. Right?
Exactly. Right. Okay.
Right.
And a lot of times, we have a child where one eye sees perfect and you can see anything. So that's what we call like lazy eye. And that's another instance where it's very important to intervene at a very early age so that we can stimulate the eye that it's not seen properly. Because, again, the child is not going to tell you, I can see as well my left eye. He's not going to tell you that. Okay? And sometimes at the pediatrician, he doesn't know. And at the pediatrician, if they make the mistake to checking both eyes at the same time versus one at a time, they're never going to find out that this child cannot see with the left eye or the right eye. So it's very important to bring them in, intervene at an early age where the brain is still flexible, can still absorb new information. It's extremely important.
I mean, it's just horrible to think that your child might be put on medication or otherwise is considered a little funny, a little dumb, a little whatever, simply because he or she didn't quite see the way he should and does look and act clumsy. Yeah. It would be such a sad thing to do that and to be branded as that for a while, even if maybe at age 15 for some miraculous reason it gets corrected. But imagine those years before, those formative years where, and the kid knows it. He goes, I'm a little slower than the other ones and they're kind of nitpicking on me. And it's maybe only because he doesn't see things as clear as the other kids see it. Oh my God.
Correct.
Thank you very much. Go ahead, doctor.
Okay. I'm sorry, even playing sports, you might have a kid who, you have the father who wants them to play baseball or hockey, and this kid is just not performing as well as they want to. They're not able to catch that ball. Well, guess what? If the two eyes are not working together as a team, their in-depth perception is not going to be good. They're not going to be able to be successful at sports to catching that ball because they just cannot see it coming. They cannot estimate how far that object is from them. Okay, so that's another thing, even when playing sports.
Right. Yeah, as I said, look clumsy, look somehow stupid, look not active, and most likely, if those type of things are going on to whatever little degree, it is not unreasonable to assume that child will become socially less active, will be a little bit more withdrawn because, we all do that in an area where we are not so good. Well, we don't go there. You know what I mean?
Definitely, absolutely.
Yeah. Thank you very much, Dr. Napolitano.